about a very aggressive tumor, and then a very recent paper that came out that contains important information about therapy of this tumor. So this is the tumor we're talking about. This is called a SMARCA4 deficient undifferentiated tumor. It looks very undifferentiated, rhabdoid, often dyscohesive. And the most important things about this tumor in terms of immunohistochemistry is that it is usually keratin negative. It's usually keratin negative, sometimes weakly focally positive, but usually pankeratin negative. And the other thing that's absolutely definitional about this is that if you use the BRG1 immunostain or the SMARCA4 stain, that the neoplastic cells, the big cells, are negative. You can see that in this picture. The big cells have no nuclear expression of SMARCA4 or BRG1, and you see the internal control, the lymphocytes and so forth, are positive. So all other cells in the body are positive except SMARCA4 deficient neoplasms. So these thoracic SMARCA4 deficient undifferentiated tumors have been known for a while, and the WHO has now defined this as an entity, but treatment data were really not available until recently. So we don't have any kind of randomized controlled trial, but we do have this paper that has just come out in JTO Clin Res Rep 2024, and it describes a cohort of 92 patients with stage 4 disease, 92 patients with SMARCA4 UT, 58 of whom had stage 4 disease at diagnosis, 16 of which had recurrent or metastatic disease after the initial diagnosis. So importantly, they described the therapies that were given to these patients. Some of them got first-line systemic therapy. The most common were chemoimmunotherapy combination, 41%, chemotherapy alone, 33%, or immunotherapy alone, 16%. And the interesting thing is, although responses were bad in all of these groups, the longest responses, so there were only 5 patients who had a durable response more than 2 years, and all of them had immunotherapy as part of their first-line regimen. So this is very important data to know when you're talking to your clinician about how these lesions should be treated. So again, SMARCA4 deficient undifferentiated tumor or SMARCA4 UT. The most important things about diagnosis, this kind of undifferentiated morphology, keratin negative, BRG1 loss, and tumor in the thorax. Thank you for listening.